Welcome to Ask the Doctor on WDBO, an hour-long program dedicated to your health. Each week we feature physicians from a different medical specialty. This is your chance to speak with a specialist. To call Ask the Doctor with your medical questions or concerns, call 407-290-0058. Toll free 800-329-5858. Here's your host, Rob Newton, with today's topic and featured physician.
And once again, the phone numbers are 407-290-0058 or 800-329-5858. Special guest today from Urology Health Solutions right here in Central Florida, Dr. Richard Lotenfoe, and he is here to talk about prostate health and care. Now, ladies, just because we're talking prostate health doesn't mean you walk away from the radio. We want to make sure that you understand what is going on with your husband or significant other's body and what's happening with the prostate, and what can be done if there are problems. What are the symptoms? What are things that you too could be looking out for to help your husband stay healthy and active? So we're going to open up the phone lines again at 407-290-0058 or 800-329-5858. Doctor, welcome to the show. Tell us about your practice.
Well, Rob, thank you very much. I'm very happy to be here. I'm based in Celebration. I have another office in Winter Haven in Polk County. We're specializing in prostate treatment of prostate disorders, but I also do regular urology. I also treat things like erectile dysfunction, kidney stones, and other bladder dysfunction. I'm by myself, and actually one of my specialties in all these treatments is trying to do it minimally invasive.
Very good. Now, I see, too, that you're a Rotarian, which means you're a community leader.
Absolutely. I'm dedicated to this organization, and it's a very good organization, and I'm very happy to be part of it.
What is the biggest thing that comes to you as far as the number of cases that might prevail over any other number of cases for a certain malady? What would that be?
I think that prostate problems are probably, for me, the most common types, maybe because I specialize in it and I treat a lot of them. And I use state-of-the-art technologies in order to treat these problems besides just medical treatment. So prostate problems are probably some of the most common
Is the prostate problem something that every man, even in today's open society and as advanced as we are, human beings, men are still very, very shy to talk about it and very shy to admit they have a problem?
Absolutely. Men are macho. They don't have problems. Their wife usually brings them in or brings it to their attention. Often people also think, well, it's part of aging. I'm getting old, so I have to be up at night a lot, or my stream is slowing down. And many men are basically in denial. I have patients that are, have significant symptoms when I just ask them and interview them. And they keep saying, well, I'm doing okay. I'm doing okay for my age. And there are very simple solutions to a lot of these problems. Most of these problems do not need surgery. You don't need an operation. We can do things with medical treatments and other type of treatments, and you don't necessarily need surgery.
Okay, where do you draw the line when you're interviewing a patient and they say, well, doc, I may go out on a Friday night, have 4 or 5 beers, 3 or 4 couples hang out together on a Friday. I have 3 or 4 beers maybe and some water when I get home. And, of course, I'm going to wake up 2 or 3 times a night. Is that always the case that he's okay?
Not always. Of course, fluid intake is a significant contributor to the nighttime voiding. But, when you go a little bit further and ask about the regular instances when somebody doesn't drink, or when somebody does come to me and states, well, I go to at night all the time, but I drink a lot during the evening, my first advice is, moderate your fluid intake in the evening and don't drink anything at night. Sometimes people still have problems in spite of that. And then it's time to investigate a little bit further if there's something else going on. It doesn't necessarily mean that there's a prostate problem. Other things can be like overactive bladder, and also heart conditions can cause those symptoms. So it's always worth to check it out a little bit further.
I think every man has experienced this, and they may contribute it to age, that when they're a little guy, unless, dad's driving 4 hours from here to Miami and refuses to stop, why didn't you do that before we left home? That a lot of men in their 50s feel urgency. They don't have to go, and then all of a sudden they do have to go to where it's almost painful.
Yes.
Is that a prostate problem?
Not necessarily. It can be, but it is always, there can be other things. And believe it or not, overactive bladder is actually more common in men than in women, and especially at higher age. It is more common in men than in women.
If somebody does try to, as we've always say, hold it until we get there, is that causing damage?
Not necessarily. This is a kind of a double question, because yes, there are people who habitually have been holding it for years and years and years and develop what we call a neurogenic bladder, where the bladder is so stretched out that it cannot contract anymore. But as a matter of fact, on some people with overactive bladder, we actually give it as an exercise to try to hold it as long as they can until they reach a certain point. And then we say, well, that is acceptable. Don't stretch it out further, but take it from there.
Telephone numbers to call if you have a question for the doctor: 407-290-0058, 800-329-5858. The practice is Urology Health Solutions, Dr. Richard Lotenfoe. And what are some of the facts versus myths when people come in and sit down with you for a consultation, and you sometimes have to hold back and not smile because you think, hey, this person believes this?
The biggest myth is that if you have no symptoms, you don't have prostate cancer. If you have no symptoms, you cannot have prostate cancer. And that is probably the biggest myth that I have encountered, because early prostate cancer doesn't necessarily give symptoms. If you develop symptoms, it may mean that it's already too late. I have patients that say, I can't have prostate cancer because I have no pain. Well, pain is a late stage problem. So that is probably the biggest myth that I have to fight sometimes.
So how often and at what age should it start that a man should go to the urologist and have himself checked for prostate health?
Well, right now the recommendation is to start at age 40. At age 40, start doing a digital rectal exam, also called the finger wave. Basically, what you wind up doing is put the finger in the rectum and feel the prostate. The prostate is right on top of the rectum, and you can feel the backside of the prostate where most of the cancer develops. So you get an impression of the prostate. You get the impression whether there are any abnormalities, some hardness on the prostate, and the size of the prostate. The second part of the screening is a blood test called PSA. PSA is a protein that is produced by prostate cells, not necessarily by prostate cancer cells, but by prostate cells, and may give us an early indication of possible prostate cancer. So the general recommendation is to start these two tests on a yearly basis at age 40, and also keep on going until you reach the age that the life expectancy is less than 5 years.
So sometimes if a person does feel pain, it may be late in the process for something that could have been cured much easier early on.
Yeah, it is a myth with that in general that people come and say, well, I cannot have cancer because I don't have pain, I don't have problems. Early cancer in general does not give any symptoms. At the same time, the earlier you get the cancer, especially prostate cancer, the earlier you catch this cancer, the easier it is to treat, and the highest possibility that you will become cancer-free for the rest of your life.